Hello, my name is Salithio Ray, and I'll be recording a thing on therapeutic communication and history. First thing you're going to do is a scene size up. You're going to identify any dangers to the EMS providers. You want to observe the scene and identify dangers. You also want to see if the patient is inebriated or feels flagged by EMS or dispatch, or if the patient is suicidal, which dispatch could also provide. If the patient is any of these things, you probably want to get police and utilize some special interview techniques. So when you contact the patient, you want to first greet them with a name and who you are. So I would say, hello, my name is Salithio Ray, and I'm with CFD Ambulance 433. At which point I'd shake the patient's hand unless they seem standoffish and didn't want me to invade their personal space. I would then position myself eye level with the patient, maintain good eye contact. This lets them feel like they're in some level of control, and also that you're concerned about their health and want to help them. Once you begin obtaining your past medical history, you want to use the patient's name. You want to use the patient's name as soon as you can, and you want to repeat that name throughout the whole interview process. To remember the name, you're going to say it to yourself. You're going to then visualize it in your head, and then you're going to familiarize it in a way that you can feel comfortable with. Once you do that, you want to maintain an open stance. It indicates that you're confident in your ability and your ability to care for them. It is important to never invade a person's intimate zone, especially if they're a child or someone of the opposite gender, or an elderly person that might have some kind of Alzheimer's or something and don't feel comfortable with you getting close to them. The intimate zone is less than 1.5 feet, so you'll have to warm up to them before you can start taking vitals. And if they're hostile or standoffish, you want to explain that if they cooperate, that you can provide a higher level of care, and it'll be beneficial to them in the long run. The first thing you want to obtain is the OPQRST. The OPQRST was first designed to find out about pain related to trauma, but it has been modified for all EMS to identify factors related to the signs and symptoms of the patient. You want to start by asking when they began experiencing pain. How did the pain begin, and how is it progressing? You want to ask open-ended questions to obtain the most accurate information from the patient. Sometimes their method of encoding their message will provide insight into their issue, especially if they talk about how it hurts or why it hurts or what they're doing. And just if they use their own words, it usually provides you with a better picture of what's going on. So the next thing you want to find out is if anything they do makes it worse or if it makes it better. So you want to ask, is there anything that lets you experience less pain or issues? Or do some actions make the pain worse or better? The next thing you want to find out is quality. Quality is basically what the pain type is. Is it sharp, dull, achy? It'll tell you a lot about what kind of issue the patient is having. You want to find out about this by saying, how would you describe the sensation of pain you're experiencing? You want to avoid leading the patient's answer by providing examples of the pain. So if you're going for a cardiac issue, you don't want to be like asking questions about if the pain is sharp or if the pain is like somebody sitting on their chest, because that'll often give the patient an easy way to answer the question, and they'll often just say yes. Next thing you want to know is where it's at and if it goes anywhere else. So you'd ask if they're feeling pain, where they're feeling the pain, and if the pain goes anywhere. Mostly if you're looking at radiation, you're looking at how the pain is being referred to other parts of the body, and this will usually indicate what organ or body part is being restricted or is sick. Next thing you want to know is how much pain they're in. You don't want to ask on a scale of 1 to 10, because often they'll just say 10, or it just gives them an easy way to say that they're in a lot of pain. So you just want to say how much pain are you in, and provide them a way of explaining if they're in a lot of pain, or if they're just feeling some kind of pain, or you can even ask them if they've ever felt pain like this before. Next thing you want to know is what kind of pain, like what the timing of the pain is. Is the pain constant, or is it intermediate? Or is it intermittent? And how long they've been feeling the pain. Next thing you want to know is the associated symptoms or pertinent negatives. You want to utilize a high degree of suspicion and differential field diagnosis. It allows you insight into the issue, and it kind of narrows your care. This insight can provide the caregiver with possible treatment options and an expectation of what trajectory the patient, like what their health issue will go, and what you can prepare for. Next thing you want to know is past medical history. This is everything that's ever happened to them relating to the issue at hand. Most people use sample, but provides a more in-depth look into it. But sample usually is the best method to use in the field. So the first thing you want to find out is like what their general state of health is. You can find this out by asking, how are you doing? And this will provide them a way of answering the question in an open way, and allows you insight into what's going on with them. You want to speak in a professional manner. You want to maintain a slow, steady method of speaking, and you want to remain calm. And asking how the patient is feeling provides information on their mood, state of mind, and general well-being. Especially in older people, if they're depressed, they'll often mimic dementia, and it will make the interview a lot more difficult unless family members are around to provide you with a history. So next thing you want to do is signs and symptoms. You want to ask, how are you feeling? Are you currently experiencing anything out of the ordinary? This allows them to explain what's going on with them. If their back hurts, it'll allow them to use their own words. Next thing you want to know is allergies. Are you allergic to anything? Have you ever been diagnosed with a known allergy? When you're asking this, you want to ask questions in a closed manner about about allergies to penicillin, local anesthetics that end in cane, like lidocaine, narcotics, tetanus, toxoid, and all of the certain drugs that you will be given in the back of an ambulance or in the emergency department. Remember to inquire about allergies to drugs, foods, and insect bites, especially if the patient is presenting with signs of anaphylaxis. After you find out about their allergies, you want to ask about medications. The best way to do this is just ask, are you currently taking any medication, recreational drug, vitamin, or herbal remedy? When you're doing this, it's vital to inquire about certain medications such as Cialis and Viagra, or anticoagulants such as warfarin. This information is important for care provided in the ambulance, ED, or operating room. Getting this information from the patient is important, particularly when the patient has been involved in a trauma. While you're doing this, you want to realize that the current issue could involve under or over medication, or an allergic reaction to a recently prescribed medication. The next thing you want to find out is the past pertinent medical information. The best way to do this is ask, did you ever have an illness as a kid? Have you had any medical issues as an adult? Are there any limitations, physical changes, or complications that have occurred due to your recent medical issues? When you ask about this, you want to ask about recent hospitalizations, because this will provide you with kind of a clue of what's going on with them. And you can ask what the doctor said about their issues when they were hospitalized. During this, you want to ask if the patient has a physician or what physician the patient saw when they're in the hospital. This will be helpful for your emergency department staff when they're trying to provide care. The next thing you want to know is the last oral intake. Best thing to ask is, what have you been eating today? It's an open-ended question that gives the patient a way of communicating what they've had to eat that day without actually just saying they drank water 2 hours prior. The next thing you want to know is events leading up to. Open-ended questions are good, just asking what they were doing when they begin to experience this medical issue, and if they've had similar reactions in the past when doing the same type of activity. Next thing you want to know is habits. You want to know if they smoke, drink, use recreational drugs, or have bad habits that could negatively affect their health. Smoking is a lot of, it provides you with a scope of what could be wrong with them, such as cardiac issues or pulmonary issues. And it could provide you with information on carbon monoxide poisoning. After that, you want to ask, you want to look at your environment. You want to reevaluate the environment and collect your thoughts. You want to get a oxygen bolus and just look around, make sure nothing's changed and you're still safe. After that, you want to look for any risk factors. Does the patient seem to be becoming more violent? Were they violent when you got there? Could they have needles in their pockets or near them? So when you're providing care, you want to avoid sticking yourself. And you want to see if the patient has any kind of medical issue that could destabilize the scene quickly. After that, you just want to do your special considerations. You want to identify if the patient presents a special challenge, such as if they're a child, if they're inebriated, if they're mentally unstable, elderly, or have a sensory impairment. Any of these issues can be overcome by special interviewing techniques, such as if they have a sensory impairment, such as blindness. You just want to provide some tactile feedback. Just let them know that you're there. You want to explain the scene to them and explain any action you're about to do. If it's a child, you want to be calm, collected. You don't want to be too literal, children are literal, so you don't want to use slang or anything like that that could confuse a child and make them think that something bad is happening. If the patient is overly talkative, you want to ask closed-ended questions, just to avoid information overload. And if you encounter a situation where there's sensitive subjects that you have to talk about, you want to preface every line of questioning with a professional statement that provides the patient with a small amount of comfort and control. You just want to explain what kind of questions you're about to ask, and you don't want to surprise them with anything that could be embarrassing for them. You also want to make sure that there's nobody in the room that would limit their ability to respond, and such as teenage children. Sometimes if their parents are in the room, they won't open up and actually provide you with the complete history. Next thing and final thing that you want to be aware of is silence. If the patient is unable to talk to you, or they're just remaining very silent, not talking at all, you want to conduct a brief orientation and just to see if they're still alert and oriented. And you want to assess your line of questioning. You want to make sure that you haven't offended them, or the questions you're asking hasn't made them uneasy and not wanting to respond to your questioning. If done correctly, you'll establish a rapport with the patient, good communication, and instill in the patient the idea that you're there to help them and provide them with the most high quality of care. Thank you.